Hello, I'm Bongi. I'm the lead educator for Advanced Clinical Practice. Today, we are going to hear from different colleagues working in advanced practice roles, both in acute and community. Advanced clinical practitioners come from a different range of registered health professionals. They include nursing, midwifery, allied health professionals, pharmacists, and healthcare scientists.
Hello everyone, I am Binu Cherian, Head of Adult Interface Services, Southern Health and Care. I'm going to share some thoughts about advanced clinical practitioners. Advanced clinical practice is just not another course. It's preparing the new workforce for the future. Advanced clinical practitioners have a lot to offer to the integrated care systems. Teams such as at home are multidisciplinary and multi-organizational. They work across different settings, such as community, emergency department, and the acute wards. The ACPs can use their skills and knowledge to see patients in all these settings. For example, to prevent an admission from the community into the acute hospital, so that the acute beds are used for people that need them most. They could also work across historical boundaries of various disciplines. Therefore, number of professionals involved with the patient care could be reduced. ACPs working in the emergency department to provide holistic assessment of patients, including the frailty, would support the current shortage of skills we experience in the system. They could also be supporting the teams to take more number of high-risk patients into the community through the discharge to assess pathways for ongoing care. Leadership skills of ACPs could be utilized in the integrated working to embed new ways of working by developing new pathways, which would contribute to improved patient care. Their research and management training would complement the new ways of working and can offer solutions to some of the current problems we have. I wish all the best for all the qualified and trainee ACPs in the trust. Thank you all.
Hi, my name is Daniel and I'm the quality manager in radiology and also a reporting radiographer. So I'll be giving you a brief talk today on the advanced practice roles in radiology at Epsom and St Helier. So what we aspire to have at Epsom and St Helier is a fully integrated multi-professional team providing the best possible care to the patient. As part of that, we have advanced practice roles such as reporting radiographers and sonographers as part of our workforce. Just to give you an example, so if we have a patient that comes in for an x-ray, what the patient is looking for is not to have the x-ray as quickly as possible, but to find out the answer as quickly as possible. So by having radiographers work in advanced practice, early on in that patient pathway, we were able to provide that diagnosis quicker to the clinician so they can give the diagnosis to the patient. In addition, we're also starting the optimal lung cancer pathway shortly, which again will have reporting radiographers, reporting chest x-ray and referring patients onto the optimal lung cancer pathway. So just to give you an idea of the education behind this, so reporting radiographers and sonographers train at PGC or PGD level. And as part of that, they then go on to undertake preceptorship mentoring after they've undertaken their university training. This is undertaken in the department, the preceptorship training and mentoring by a consultant radiologist. Once this is completed, they then go on to work in their advanced practice role as either a reporting radiographer or a sonographer. What is important to understand here is that this is very much working as part of a team radiology. It's not replacing consultant radiologists, but more working alongside them. We are well aware that there are established diagnostic capacity barriers, and one way to overcome this is by introducing reporting radiography into a radiology service. As we deal with activity demand, as it increases, this gives us the ability to allow our consultant colleagues to concentrate on the more complex examinations such as CT, MRI, and interventional procedures such as biopsies. Radiography advanced practice is based on strong evidence that it can provide a safe, effective, efficient, and accurate reports to the clinician to provide a diagnostic outcome for the patient. Going forward at Epsom and St Helier, as part of advanced practice roles, we will continue to develop these, taking into consideration the patient needs, also using audit evidence and research as part of our advanced practice roles, and also to continue to focus on patient outcomes and patient care. Thank you very much.
I am Sini Jens and working as an advanced nurse practitioner in ambulatory care unit at Epsom Hospital. Advanced nurse practitioners are an integral part of the 21st century NHS workforce. We bring our own experience and expertise into this role of advanced nurse practitioners. All the advanced nurse practitioners have additional qualifications in their own area of specialty. Advanced nurse practitioners bridge the gap between medicine and nursing. We have good medical knowledge along with nursing skills. For example, when we examine a patient, we do all the necessary history taking, physical examination, investigations, make the diagnosis and prescribe the treatment for the patient. And if that patient has a wound, we know what wound products to use. If that patient requires any treatment through the PICC line, or if the patient has a portacath, our nursing skills come in and we know how to manage, how to use those lines, and at the end of the treatment, how to remove them. We also contribute to the development of our colleagues. We supervise medical students on placement, physician associates on placement on our units, SCP trainees who are doing the training. We participate in journal clubs, NMP forums. We do audits and implement the findings of the audits in order to improve our service in every possible way. All this contributes eventually to the best patient outcome. Also, we are good advocates for our patients to make sure they have the best pastoral care from our units. We also get good support from our medical colleagues and acute medicine consultants. They consider us, treat us as part of the team. They value us. They acknowledge our part in the team, the valuable role that we play in the team. And they do provide us all the necessary clinical supervision, help us to meet our competencies, signpost us to the educational events, conferences, and all the opportunities for us to grow and develop.
My name is Jo. I'm one of the ED qualified advanced clinical practitioners at the St Helier Emergency Department. I currently joined the Trust back in October, and I've been asked today to share with you a few of our areas of ACP role in relation to the 4 pillars that we do. I qualified as an advanced clinical practitioner back in 2018 and have been working in emergency departments across London since then. Within that role, there are 4 pillars of our care that are alluded to by the Health Education England framework that is therefore aligned with our RCEM, Royal College of Emergency Medicine portfolio. The 4 pillars consist of the clinical aspect, the research and audit aspect, the education and facilitating of learning, and the leadership and management role.
Hello, my name's Maddie. I'm one of the trainee advanced clinical practitioners in the Trust. I'm in my first year and I'm a physio by background. I currently work as the respiratory physio team lead at St Helier, so in the acute trust. I predominantly work on intensive care, but also C6, Merrymore and C4.
Hi everyone. My name's Trevor. I'm one of the trainee advanced clinical practitioners. I work in the emergency department. I'm just going to take you guys through about what I've been doing through this very, very tough year, especially with the COVID pandemic. It's been quite a difficult time to work in the emergency department. We've been under a lot of stress and a lot of pressures, but I think we've really come through. So I'm just going to kind of talk you through our role, or my role specifically as an advanced clinical practitioner. So I'm governed by 4 pillars, which are clinical, education, research, and leadership. And part of my role is to make sure that I'm addressing those pillars equally, so that I can provide holistic care and so that I can be a holistic clinician as well. More specifically about what I was involved in throughout this year during the COVID pandemic is I was actively involved in research. So as part of my role, I'm an active member of the research team. And during this time, I was involved in the PRIEST study, which was one of the studies that was released during, I think it was around April when the pandemic started. And what this study looked at was about how we triaged patients presenting in the emergency department with respiratory conditions, mainly specifically COVID. And it was very interesting to be part of this study because it's going to be leading us in the future to see how we deal with patients who present with respiratory conditions. So ultimately, it will improve patient care.
I'm Lucy Botting. I'm the Director of Sutton Health and Care. And I just wanted to take 2 minutes to talk to you about our higher level practice that we work to in the community setting. In terms of advanced level practice, and I'm going to focus on 2 areas, so advanced nursing practice, but I also cannot forget advanced therapy practice. And this is an area that I am immensely proud of. And I should say I'm immensely proud of all of our nursing and therapy services across Sutton. It gives me great joy, and it's an honour to be the Director of Sutton Health and Care. But for me, advanced nursing practice is something I am very proud of and wedded to. I'm a nurse practitioner myself, and have been a nurse practitioner working at a higher level for about 20 years. And I'm also a nurse prescriber. And I still practice in this field to keep my skills credible. And therefore, when I see higher level nursing practice going on in Sutton and going on in Sutton Health and Care, it is something after my own heart and something I'm immensely proud of, because it provides that extra quality, extra response to the residents across Sutton.
Hello, my name is Alan. I'm the Associate Director for Education and Workforce Development. Our Trust 5-year strategy, in alignment with recent national policy developments and guidance, provide us with a great opportunity to develop advanced clinical practitioners in a standardized, robust, and cost-effective manner that benefits the communities we serve, our workforce, and the Trust. With funding from Health Education England and the Apprenticeship Levy, we are currently supporting 25 trainee ACPs who are experienced registered healthcare practitioners, some who are nurses, physiotherapists, occupational therapists, radiographers, pharmacists, and even podiatrists, to obtain their master's level qualification that encompasses the 4 pillars of clinical practice, leadership and management, education and research, with demonstration of area-specific clinical competence. The ACP initiative is being scaffolded by our investment into building capacity to provide robust supervision and pastoral care to our trainees and practicing ACPs.